Hey, Dr. Mike here. If you want to live forever-ish, you have to know what's in and out. Stay tuned to find out.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Forever-ish. So this is one of our favorite shows. We do this at the first Monday of every month, where we talk about the things you want to do and something you don't want to do to live forever-ish. Right,
Yes,
Dr. Crystal?
that's right.
And again, living forever-ish, strong, long, vibrant lives, right? Something like that, Dr. Crystal.
Yes, I think you covered it all. Just
Good.
having vitality in your uh, elder years.
Yeah. Listen, we all want that, right? I mean, we want to be able to do the stuff we want to do for a long time. So we break this show up into three ins, the things you want to do. These are the things that are in if you want to live forever-ish. And then one thing that's an out. That's the thing you
Yes.
don't want to do. That's the thing you want to avoid. So let's start with in number one. And this could be my favorite in we have ever talked about since doing this, and it's about petting your dog. What's going on
Yes.
here, Dr. Crystal?
Well, it's more than just about petting your dog. As we will explore, we're highlighting a study that was published in October, just last month, October
Yeah.
5th, in the journal
Yes.
Plus One. And they were identifying contact with a dog. So, not just petting, Dr. Mike, looking at a dog, sitting next
Oh,
to a dog,
yeah.
and petting.
Yeah.
And the
What about
effect,
kisses on the nose?
I'm sure that's just taking it to the next level. I'm
Okay,
sure it's
good.
even better.
Yeah, so this study was titled Effects of Contact with the Dog on Prefrontal Brain Activity, a controlled trial. I mean, basically the prefrontal brain activity, that's straight cognition. That's executive function. I mean, that's your big brain area basically, right?
Yes, and it's also associated with social engagement as well. And so it's nice that these researchers took place in Switzerland. The researchers in Switzerland decided to take a closer look at the effects of animals, in this particular case, dogs. And I do want to just backtrack, Dr. Mike, because I know you're
No.
partial towards
No,
dogs.
you're not. You cannot add other animals to the study. That's not what
I
they
am
did.
adding other animals to the general idea that therapy animals have been shown to support the boost of endorphins that helps with pain, lower blood pressure, anxiety. So it's not just dogs, Dr.
Okay.
Mike.
That's fine. I'll give you that. So interesting. So this was, I mean, this is a small little study, right? It's nothing. More research is definitely needed, but it makes sense to me that this plays out and works. 19 men and women. They went through 6 sessions, right? 3 were about imaging and scanning, and I think then why they were petting a dog, why they were interacting, and then they went through 3 sessions, right, where it was like they replaced the dog with a stuffed animal. So it was like 3 sessions with the dog, 3 sessions with the stuffed animal. Am I getting that right?
Yes, that's right.
So what did they find out?
Well, they found out that, and just to go back, there was imaging with both groups, the groups with the actual dog, as well as the groups who were viewing the stuffed animal or sitting next to the stuffed animal or even petting the stuffed animal. And by the way, the stuffed animal was
Oh,
filled with a warm water bottle so that it was just to try to emulate the temperature
yeah.
difference.
Okay, let me backtrack because when I was reading this, Dr. Crystal, I was thinking this was a crossover study. So that's not what they did here. It was a straight half of the 19 people were with the real dog, the other half with the warm bottle and the stuffed dog. Or here I'm actually reading it was a stuffed lion, whatever that is. But they all went. But both groups went through the same scanning of that prefrontal brain.
Yes, and that was while they were, and it was a step-by-step process. So you can imagine this. Session one, you go in, they put these devices, just kind of like sensors on your forehead, and you sit. They were staring at a white wall, and then they brought in the animal, and you were just looking at the animal, and then the animal came next to you on the couch
Oh,
and but the animal wasn't moving, just sitting there. And then and there were, I think, 2-minute phases of all of this. And then the last phase, you were able to pet the animal. So what they were looking at is the whole time evaluating, um, measuring oxygenated, deoxygenated, total hemoglobins, oxygen saturation in the brain. So basically, brain activity
yeah.
during this entire phase. And then they repeated that, with the actual animals, and then they repeated it again the with the stuffed lion,
With the stuff like
stuffed with the
that's.
water bottle.
I can only imagine though the group that had the actual animal when the dog. So they looked at the dog first, then the dog comes up and lays against them. I mean, that dog must have wanted to be petted so bad.
Yeah,
That must have
but
been funny to watch.
I think these were trained animals.
Well
That
trained, right?
well trained. It would not have been Winston, but that's my dog. Winston would not have cooperated with the study researchers.
So at the end of the day, I mean, obviously we know that the real dog it performed better when it, at least for us in our brain, right?
Yes, far more prefrontal cortex activity, as you mentioned. That part of the brain plays an important role on how we deal with social and emotional situations and engagements. And the interesting finding, Dr. Mike, the brain activity persisted after the activities with the real dog were completed. So there
Yeah,
were
so there
lasting.
was lasting effects here, right?
Yes.
Yeah, yeah. I like this. Now I
Hmm.
know other animals are fine, but this was done on dog. I mean, with dogs. So right now, the only conclusion we can make is that dogs are the best pets.
Based on this study.
Yes.
But the other conclusions that and there's so many, when you really think about this, I think we do need a more research here to identify, uh, the stuffed animal. I just don't know. I mean, how can you compare that to a living being?
Yeah, yeah. I mean, maybe next it's dogs versus cats.
Yes.
Ooh. Yeah. Okay. Let's go. So that's in number one. Really enjoyed that. That was good. So go and pet a dog, and it's just better brain function, and you're gonna feel more socially connected, and that's important for living forever ish. Number two. Again, these are the things you want to do, and this is about calcium intake. And it turns out that if you're getting enough calcium, which a lot of people aren't, that may be protective against kidney stone reoccurrence. Now, that may sound weird to some people, right? Because a lot of people think kidney stone, calcium, I'm getting too much. Now, there might be something there with that initial stone formation, but what we're talking about is when they clear the stone, making sure you still get enough calcium is important so you don't get reoccurrences. That's correct, right? That's what they were looking at.
Oh, yes, Dr. Mike. And I think I'm happy that this study took place. Again, this was August 2022, so hot off the press. And because people are confused about this, I just had a conversation with a dietitian last week who's, she's seeing a patient who has recurring kidney stones. And she's convinced that the lady or her patient doesn't need calcium. And I said, oh, I don't
Yeah,
know about that.
yeah,
And I know how it can be confusing with some of the most common types of stones being calcium oxalate, calcium phosphate. These are common types. So in your mind, you would think, no brainer.
yeah.
If these stones are made of calcium, I need to avoid calcium.
Yeah, but and we need to clear this up because it's not the calcium. It's the form of the calcium that is making the urinary system acidic. And that's where you get the problem and stone formation. Another classic stone is the uric acid stone, right? Again, it's the acidic environment, right? That is forming those stones. So there are other forms of calcium, very common forms in nature and supplements that actually can bring up that acidity, make it more alkaline. And I think
Yes.
that's what this was about, and that's where people I get think they get confused.
Well, yeah. Well, in this study, it was more of just an association study. So obviously, there was no direct intervention, but it was the researchers enrolled 411 individuals who were symptomatic kidney stone formers. Some people are just formers, and then 384 control patients who did not have the condition, and then followed them for a median of 4.1 years.
Right.
And at the beginning of the study, they were provided, or they were given, a food frequency questionnaire. So of course, they're just looking at the
Right.
diet in the individuals to try to figure out from a dietary perspective what's causing, are there differences in the people who are forming the stones and the people who are not,
Right.
and
Right.
try to identify some common, a factor that could be related to maybe the ones who were not forming the stones. What is it about
Right.
their diets? And so the researchers found a recurrence of kidney stone symptoms was experienced by 73 of the stone formers, and they adjusted for fluid intake, energy intake, weight, as well as non-dietary risk factors. And once they adjusted for all of those risk factors, the one thing that stood out was lower dietary calcium remained a significant predictor of recurrent symptoms.
And that's because most of these formers, right, these stone formers, were probably told by their nutritionists and their medical doctors to avoid calcium because no one's really understanding it's the pH that has probably the greatest impact on whether you form a stone or not. Now, listen, this is still it's small. I mean, you're talking about 73 people out of the whole group that reoccurred, and I mean, obviously these are questionnaires. We're always a little suspect, right, of questionnaires, but it is interesting, and I think it just, to me as a clinician, it just shows that there's still a lot of misunderstanding of why stones form, and if calcium is really one of those triggers of that. And in my opinion, it's more about the acidity of your system that's going to cause the stone.
Yeah, potentially. The other thought is if you don't have enough calcium, then the body's going to pull that calcium from the bones, from the reserve, and maybe that's what's kind of getting some of that calcium into the soft tissue as well, and as well as maybe related to the stone formation.
Interesting thought there. And here's another thought I want to add to that. Is it when you have the calcium being pulled out of the bone in a disproportionate way, what forms are those calcium? Do they tend to be more of the oxalate
Oh.
forms and stuff like that, and that they are more acidic, and that's what's so is there something there? Oh,
Potentially, but
right.
I would have to say this now. This is just a plug for Life Extension, our sponsor. There, we do have a kidney stone protocol, and I'm sure there are some answers there on
Yeah, check that out.
lifeextension.com.
Yeah. Yeah. So and I know you always suggest, as the clinical nutritionist, okay, I'm gonna see if I get this right.
Okay.
I'm not gonna get it right. Wait, 1,000 milligrams for men, 1,200 milligrams for women a day, or do
Yes.
you,
Yes.
or
That's the RDA.
oh, okay. But you actually, I think, actually just put it all in. You basically say 1,200 milligrams or so.
Yes, from both diet and supplements.
Yeah, and
Diet
yeah,
and
yes,
supplement.
you have to add those
Hmm.
together. So make sure you're getting enough calcium. Listen, you don't want stones if you want to live forever-ish because they're going to knock you out. You're not
I
going to be very
know.
vibrant if you're dealing with
They
stones all
are
your life.
debilitating and very painful.
Yeah. I've never experienced them before, thank God. I don't know if you have, Crystal, but I do. I've had friends, patients, and more. It's definitely painful. All right. So, in number three is cranberry supplement that boosts memory. I love this, Dr. Crystal. When we find another health benefit of a nutrient, most people, when you say cranberry, they're thinking urinary tract,
Hmm.
bladder, that kind of stuff. But
Hmm.
now
Hmm.
there's evidence it helps with memory. Tell us about that.
Yes. Well, first, let's just talk about an interesting quote, if I'm allowed, Dr. Mike,
Of
from
course.
the study introduction. To me, it was just eye opening. And they state the World Health Organization estimates by 2050, 22% of the world's population will be over age 60. This is a
Right.
product of increasing life expectancy, which should be viewed as an exceptional achievement, yet the improvement remains somewhat overshadowed by the absence of preserved quality of life. And so, Dr. Mike, when we talk about live forever ish,
Yeah,
it's
yeah.
about preserving the quality of life. And they go on to say, with age, the predominant risk factor for numerous chronic and degenerative neurological conditions, maintaining quality of life represent a significant global change.
It is a challenge because again, if you take the standard American, the standard European, especially out in the West, we already can help you live longer. The medicines, all that kind of stuff. But is it the strong, vibrant, healthy, longer life that we're talking about? And it's not. That's why we do this show.
Right.
And it's not just the in and out. All of our podcasts hopefully give people tools and information to really carry good health on for many, many years.
Right. So the researchers um, wanted to see if cranberry powder, basically a supplement containing powdered cranberries, if it was given for 12 weeks, would it improve uh, brain health, memory, blood
Yeah.
flow to the brain in older individuals?
And some people might hear this and they'll be like, well, how do they just pick that? Like, does someone one day go, hey, I'm going to study cranberries? Well, maybe that may happen. But mostly, cranberries, we've talked about this before, Dr. Crystal. Cranberries have a nice bright color. That color is representative of a lot of good pigmented antioxidants, which are very important, we already know, in brain health.
Yes, and the researchers kind of talked about that in their introduction as well. How we know blueberries, for example, are great for brain health, and the cranberry. You just look at that deep
It,
red
it
color.
looks healthy, right?
Yes.
It does, but of course, to eat it, you got to add a lot of sugar to it. That's the problem with cranberry.
I know, but they're rich in polyphenol, antioxidants. So yeah, they kind of said, "Hey, we don't see any research with cranberry.
Yeah,
Everything's all about bladder health. So we're going to just take it there and see if you would receive benefits." So they enrolled 60 participants between the ages of 50 to 80, and they were given a supplement that contained the equivalent of 1 cup of fresh cranberries or placebo daily for 12 weeks.
I wonder. So 1 cup of fresh cranberries that you can't. I mean, cranberries are tough to eat. They're very tart. I wonder how they actually ate that. I don't.
No, it was a supplement with the equivalent of
Oh, the
1 cup.
equivalent. Oh, that makes, because I
Right.
was going to say, when you and I always talk about cranberries, we always say go to the supplement because the juices, anything else you're going to try to use with cranberries, they do load it with sugar to offset that bitterness.
Yes, and what's nice, the supplement provided 281 milligrams of proanthocyanidins. That's one of
Yeah.
those
Those are those
antioxidants.
antioxidants. Yep,
Hmm.
very good. Does it makes sense? It really does. And I'm glad to see, when you take a nutrient and you look at its different antioxidant, profile, it's impressive to see all the different health benefits that are coming out of that.
Yes, and one other note, the participants were healthy aging individuals. individuals. So these were
Yeah.
not individuals with dementia or any type of cognitive impairment, but they assessed blood chemistry, cognitive function, and this was conducted before and after the treatment period. And the participants who received the supplement showed improved episodic memory performance and neuronal functioning compared
There you
to
go.
placebo.
Sounds good. So get some cranberries in your system if you want to live foreverish. Now
Yeah.
let's go to our out. This is what we don't want. This is what you want to avoid. And this one is colorectal cancer. Obviously, this is significant. It's one of the number one cancers that causes death in Americans. That's why you should be getting your colonoscopies when you hit 50 or so. I mean, very important, and I think everybody understands that. But so we know right there it's an out, right? And so you don't want it, but we want to show that there's something positive happening, right? And that's with nutrients specifically folate. Folate has been in folate intake has been associated with a lower risk of colorectal cancer. So tell us a little bit about what was just published last year in the American Journal of Clinical Nutrition.
Yes, this was based on data collected from more than 85,000 individuals who participated in the Nurses Health Study. And there are lots of kind of sub studies that's
Sub
coming out of
studies of
this
this.
population
It's a
group.
huge umbrella study, right? And
Yes.
there's all these sub analysis from that.
Hmm. And so in this study, folate intake was assessed using dietary questionnaires with follow up lasting from 1980 to 2016.
Well,
That's
that's
what's
good.
nice about these, big population studies, especially
Long.
when we know that they're detailed questionnaires looking at lifestyle factors. Medical history is conducted every 2 years with these huge
Yeah.
population
Yeah.
analysis.
And the longer it goes and they collect this data and do the analysis, it just adds more credibility to the association that they're concluding. So in this case, folate reducing risk of colorectal cancer. The fact that it was such a long study, again, it's just an association. More research is needed, but you could consider it a strong association because it was so long in this period.
Yes. Right. So greater folate intake 12 to 24 years before diagnosis was associated with a 7 to about 17% lower risk. And then if you 16 to 20 years before diagnosis, intake of folic acid, let me just back up to make sure that's clear. Greater intake of folic acid 16 to 20 years before diagnosis was associated with a 9% reduced risk. Now, there are a couple of things that I think about here, Dr. Mike. One is folate and folic acid was associated with reduced risk. And we know that's really controversial in the nutrition field.
It is because there are chemo drugs and stuff that actually are antifolates and stuff, right?
Right.
I mean,
And
so
that's
it's a little.
why
And I know there's the controversy in the nutrition world as well, right?
there is, but Dr. Mike, I think that's why this study is so important, because there is this idea that folic or particular folic acid is harmful. And I'm sure that's why the researchers specifically wanted to kind of pull out this nutrient to say, okay, in this large group of women over all of these years, let's see if there was a difference in colorectal cancer diagnosis based on this particular dietary factor.
Yeah, yeah. And then for those like in the clinical world and in oncology, just so you understand, when you do have a cancer that is formed, some of those cancers, based on their genetics, they use folate pathways to help grow, and they do it more so than a healthy cell. So these anti-folate chemo drugs are really targeting cells that have revved up those folate pathways beyond what a healthy cell uses. So again, just because there's anti-folate chemo drugs, it doesn't mean folic acid or any of its forms causes the cancer. It just simply means those cancer cells that have already developed are using those folate pathways more, and we're just shutting those pathways down.
Yes. And so ultimately, the researchers said there was no evidence that high folate intake in the post fortification period, meaning, after we
Yep.
started fortifying everything with folic
Everything.
acid, was related to an increase
That's
in
awesome.
risk in the
Yeah,
US population.
I like that. So, and I like the way we took an out. Like, we don't want this cancer. Like, we don't want any cancer, but colorectal cancer has it's if it's diagnosed in advanced stages, Dr. Crystal, it's hard to beat. You know, and so that's definitely not going to help you live forever-ish. But then we come around, we say, but here's a way that you can give yourself a chance of decreased risk. And again, it goes back to nutrition, doesn't it?
Yes.
So often, everything we talk about goes back to simple things, Dr. Crystal. Simple nutrition and simple activity.
I know.
Well, there you go. That's your 3 ins and an out for living forever-ish. Again, hopefully this kind of information helps you to achieve your goal of a long, strong, vibrant life. And again, that's really why we do this show, and it's why I know I do, and I think Dr. Crystal focuses so much on nutrition and lifestyle things, because that's we want to do that. We want to live forever-ish
That's right.
at the end of the day. Hey, don't forget at liveforeverish.com, there's a whole bunch of other episodes you can download. When you do that, please like, share, and comment and subscribe so you never miss a show. Now, we call it the 1-2 punch. First thing you want to go in there you go. She's punching now. Put in your email address, and that way you can join the family of Live Foreverish. And then right there, you can click whatever area, or what do they call them? Whatever app you like to use to listen to your podcast. You can just click it right there. It's the 1-2 punch at liveforeverish.com. I'm Dr. Mike. Thanks for listening.